this chapter, we'll be talking about tic disorder mimicking conditions, or some things besides tics that can look like tics. Generally, for child neurologists, tic disorder is pretty easy to diagnose. There's not many things that occur in children that mimic tics that aren't easy for a neurologist to figure out, usually just by taking a little bit of a history. One concern families often have is, are these movements seizures? There's a few different ways to differentiate between seizures and tics. The first is there any behavior arrest? For example, people with tics can often have their eye blinking or some sort of unusual movement and keep going on about their business as if nothing happened. Their sentences don't get interrupted, their movements aren't interrupted. Generally with seizures, there's some sort of brief period, a brief lapse where there's what we call behavior arrest, suddenly stopping doing what you're doing. Another important way to differentiate between seizures and tics is, do they occur during sleep? One of the first questions I'll ask families when they have a child who is having some sort of suspicious or unusual movements, especially if they're occurring very frequently throughout the day, is, do the movements go away when the child is clearly asleep? With seizures, the unusual movements or spells will generally occur during wakefulness and during sleep. With tic disorders and almost all other movement disorders, there's resolution of the movements during sleep. A second sort of movement, which is sometimes confused for tics, especially complex motor tics, is what's known as chorea. So chorea is an older term that in the word root means dance-like. Can be a writhing sort of movement, which we might call choreoathetosis. It can be more ballistic or sudden sort of movements, which we call a ballistic sort of chorea. There's a few ways to differentiate between chorea and tics. The history is important here, because if you remember, complex motor tics, the kind which would mimic chorea, tend to be preceded by simple motor tics. So sometimes I'll ask a family if they've recognized or had any other sort of unusual movements occurring earlier. If I get the story that yes, there's been lots of simple motor tics, maybe eye blinking tics, facial grimacing, it makes the movement which they're concerned about more likely to be a complex motor tic rather than chorea. And there's some other ways to differentiate it. There's some tests that neurologists can do to help differentiate between the two sorts of movements. Another movement which can mimic tics is something called a stereotypy or a stereotypic movement. The ways to differentiate between stereotypies and tics is that stereotypies tend to be more stereotypic. That means they're the same over and over and over for many years. So, for example, a child may have a hand flapping stereotypy, unusual movements of their hands when they're excited, anxious, and frustrated. And parents will say, I started noticing that back when my child was, 2 or 3 years old, and now they're 4 or 5 and they're still doing this sort of movement. That makes it more likely to be a stereotypy, that it's been the same movement over and over. Where tics tend to wax and wane, you have an eye blinking tic that lasts a few months. Maybe it'll turn into a facial grimacing tic. The tics wax and wane, where a stereotypy or stereotypic behavior is usually the same for longer periods of time. Stereotypies tend to come on at a younger age than tic disorders. Again, that example of a 2 or 3 year old who has a repetitive sort of behavior would make that more likely to be a stereotypy. And then stereotypies are usually associated with other sorts of behavioral disorders, say autism or pervasive developmental disorders. So when I'm talking to a family, I might ask a little bit about some other sorts of symptoms. The final thing which mimics tics, and I talk to families about very often, are allergies. It usually works the other way around in my office, to where families have seen an allergist and have had concerns about allergies. Often children will have an eye blinking tic and they'll see an allergist or their pediatrician about dry eyes, a sniffling sort of tic or throat clearing tic. They'll worry about some sort of environmental allergy. But occasionally I'll have a family come in the office with throat clearing or cough, and I'll think, I really think this is an allergy or some sort of throat or eye irritation, and refer the family back to the pediatrician for some sort of diagnostic testing regarding allergies or throat irritation.